My name is Clifford and I'm delighted to be a facilitator for session number 3. Our third session today is Master of Public Health at NUS School of Public Health. Let me give you some information about our speaker this afternoon. Associate Professor Liow, Hsiang, Vice Dean of Education, Swee Hock School of Public Health. He has 14 years of experience in global health, focusing on HIV prevention, disaster relief, and rehabilitation. He lectures on global health and design, implementation, monitoring and evaluation, and serves on international boards for social and public health issues. In this session, he will discuss how the Master of Public Health, or otherwise known as MPH program, prepares future leaders to navigate the evolving public health landscape, explore how the program integrates evidence-based approaches, data analytics, and interdisciplinary experiences to tackle health challenges and improve community health locally and globally. Ladies and gentlemen, put your hands together to warmly welcome Associate Professor Liow.
Thanks for coming for this session. So my name is Hsiang, you can call me Hsiang, and I'm here to introduce you to the Master of Public Health program. Also, I'll give a slight introduction to the graduate diploma because that's a sort of a step before the Master of Public Health if you should choose that. So before I start, maybe I'll give you a short video on our school. So take about 3 minutes or so, 3 to 4 minutes. So just sit back and enjoy.
Public health is connected to everything we do. It deals with more than just infectious diseases or chronic illnesses. The way we eat, live, learn, work, and play, anything that affects your health and well-being is part of public health. At the Swee Hock School of Public Health, we apply decades of experience in research, training, and practice to protect and advance the health of communities, both in Singapore and the region. The cornerstone of public health is research, but it's not just about collecting data. It's also about how we turn that data into policies and programmatic decisions for implementation. Our end-to-end approach to translational research starts with evidence generation through data collection, meta-analyses, and systematic reviews. When it's not readily available, our researchers design studies to collect the data they need. We then take it a step further and use that data for modelling and analysing disease burden and economic impact. These techniques allow us to see into the future, if you will, and predict outcomes of policies and interventions. With all this, we advise policymakers using evidence-based research on policies and programmes aimed at improving the health of Singaporeans and future generations to come.
All of us face the same challenges. We all want a health system that is low cost, very high quality, and with universal access. And over the last 5 decades, Singapore has learned so much that we can share with the wider region. And likewise, we have so much to learn, and hence these regional collaborations are absolutely critical to us.
Our students and faculty travel to countries in the region to see how public health and healthcare systems work in these countries. Our faculty also partner institutions in the region, for example, for antimicrobial resistance and infectious disease modeling in Cambodia, with Bangkok on health technology assessments, and with other countries and partners in other areas such as healthcare management.
The partnership between CANA and US School of Public Health is looking at to develop more evidence around how we can better address the public health. At the same time, to develop more capacity of public health practitioners around the public health research. We also try to work together of how can we, the two institutions, can learn from each other.
Another very important the School of Public Health did is the policy dialogue. This is also bring together all the experts in the region. I join the tobacco control program in the region, and then we share a lot of things about in our country, in other countries as well. I think this is also the way of working together and then how we can solve the problem and propose the idea to tackle with the problem.
The school doesn't just focus on the public health issues of today, but also how we anticipate and prepare for the public health challenges of tomorrow. Our education program trains our students to think about making a real-world impact in terms of health policy and program design, implementation, and evaluation, always focusing on current and emerging public health issues.
So the skills that I learned from the School of Public Health are still relevant to me even today. The program not only provided me with the technical knowledge in my area of work, but I learned to develop the open-minded and collaborative mindset in my career. The school has also been a great resource and network to me, and we have been working together for many years now to implement the best practice in workplace safety and health across Vietnam. Personally, I find out I learn something new every time we work together.
I came from a social science background. In fact, when I came to the school, I was a little bit fearful of whether I would be able to catch up. But all these fears were pretty much unfounded when I started taking modules here. I had the opportunity to clarify these concepts with both my classmates and colleagues. I believe the core curriculum that the school offers also provided a very strong foundation for me to be a public health researcher, and there are many opportunities here to grow as an independent researcher. For example, to lead research grants, to lead research projects, which has really prepared me very well, I believe, for a career in academia.
The Swee School of Public Health continues to increase its expertise both in providing technical guidance to the Ministry of Health in Singapore and also research evidence that's useful in developing and evaluating policies in public health. This is not only true for Singapore but also within the region. The problems that occur in Asia are not the same problems that occur in Europe or in North America. And therefore, it's very important that Asia has its own centers of excellence. And Singapore is well placed to be one of those centers of excellence.
Back when we first founded the Department of Public Health in 1948, the challenges revolve around infectious diseases, malnutrition, and issues related to vaccination, sanitation, and clean water. Now, things have changed. Countries in Southeast Asia have reached a level of development where the issues have shifted to chronic illnesses such as diabetes, heart disease, and mental frailty. Working in public health is immensely exciting, for nothing remains constant in this field. What is certain is we will be ready for it.
Okay, so that's a short introduction to our school and a bit of a background to our school. So, sorry, it's not coming up on the screen here. Yeah, that's okay. So, people always ask what is public health. So, this is a short introduction to public health for those of you who are maybe thinking about a career in public health or coming into public health. So, this is a quote from our founding dean, and he says that public health is the science and art of preventing disease, prolonging quality lifespan, and promoting well-being and efficiency through organized community and governmental efforts. So that's in short capture of what public health is about. Let me see if I think is, I'm sorry, my clicker is, it's too far away, I think. I may need somebody to help me to click. Yeah. Next, please. Okay. So, public health looks at three aspects, right? So the first aspect here is on protection, and I think this is what most of us are familiar with. So we talk about controls of infectious disease, which I think during COVID, that was something that we are all familiar with. Our school worked together closely with the Ministry of Health in guiding policies and also the guidelines. Emerging health emergencies, managing health emergencies, environmental hazards, and healthy workplace. Next click, please. The other part is on prevention. Right? Prevention, we talk about screening and vaccination. And the third part is on promotion. So that's promoting health behaviors, improving social determinants of health. So I'm not sure whether amongst our audience here, there are some from the social sector, all right? If you're from the social sector or social service agencies, this is actually very much for you, because the intricate relationship between public health and social determinants, because health, if you think about it, right, a lot of the cause of bad health or poor health actually comes from social factors, and you can't actually tease the two apart. You want to talk about health, improving your health, you have to also consider the social aspects that actually cause health. And also, it works the other way around. Bad health then contribute back to poor social status. So that is very part of it, of what we do, the improving the social determinants of health. Okay, next please. So what do our programs do? I think I got to move a bit to the side, so sorry about that. Our program, the MPH program, equip public health professionals to use systems and evidence-based approaches. And so the one highlighted there and the one underlined are the key to identify and solve problems, public health problems, to improve the health of communities. Next click, please. And we produce, we call it I-Cube graduates, the 3 I's. Next click, please. And that's interpret data, implement programs and policies, and to integrate evidence. So these are the 3 core, if you like, skills that our program are training our graduates to have. Next. So where do our students come from? Next click, please. They came from basically everywhere in the world. A lot of them, you can see that they are from the Southeast Asia region. Okay, thanks. Next click. And who joins our public health program? If you can look at this, a lot of them might come from the health area, right? Medicine, dentistry, but not most of them are actually not doctors. So if you are doctors, yes, that would be relevant to you. But we have many other allied health as well. Okay? But you can see that quite a number come from sciences. Allied health is there at the bottom. Social work, food and science. Okay, next, please. And these are the competencies that we focus on. Next click, please. We have 4 competencies. So if you join our program, the 4 key areas that we are training you to have is epidemiology, biostatistics. These are our so-called bread and butter of public health. Then social and behavioral sciences, and health policy and systems. And next click. And we have something called cross-cutting competencies, where students will learn across all our courses. And those are in ethics, leadership and teamwork, communication, and professionalism. So one thing that you will note if you do join our program is that we focus a lot on group work. And that's what I usually tell students. One of the key part of public health leadership, especially in the career in public health, is actually the collaboration between teams. And so our courses are actually designed that way. In fact, you will learn more from your colleagues. Your colleagues will come, your students, right, your peers will come from various backgrounds. They come from Ministry of Health, Agency of Integrated Care, Health Promotion Board, the hospital clusters, social service agencies, and that rich background of information where you come together to solve problems together. There's something that you can't quite learn just from listening to lectures. That group work environment is the best way to actually tap on the minds and on the backgrounds of your peers. Okay, so that's part of the professionalism, communication, leadership, and teamwork, cross competency. Next, please. So the question you probably ask is, how long is this program, right? Okay, so we have a full-time option and a part-time option. So the full-time option is 1 year, maximum 2 years, but usually it's 1 year. Next click, please. And that's usually starting from August to June. So our part-time option, next click, is 2 years and a maximum of 4 years. So next click, please. And that goes into the second year. Okay. And next click, please. How much work do you need to put in? Okay, that's another question, right? If you do, especially for part-time students, they will say, how much work, right? Is it going to take up a lot of my time? And for full-time, for first semester, you're looking at 3 days of work. 3 days in the beginning because we have orientation program. Okay, so it's 3 full days. Afterwards, you're followed by about 21 contact hours a week. So you're looking at about every week, 21 hours of face-to-face. And then the second semester is about 17 hours per week. Now, if you're, there's something called the special term. Special term is where we have condensed, what we call intensive courses, where in a week you will cover a full course. Okay, and so that's quite popular among students because they want to clear their units in the shortest possible time. If you're a part-time student, in the first semester, you have that 3 days of orientation, followed by 9 contact week per hour. So you're looking at about 9 hours a week. And the second semester, same. Next. Yep, thank you. And the next one, thanks. So it will be about 11 hours and 9 hours. So in general, right, if you're going to be a part-time student, you're looking at this kind of a workload. Okay. And the total of number of units, usually one course is about 4 units, and the entire program is about 48 units. Okay, next, thank you. You may ask, so what courses are there? Can I read? And this is what I usually tell students. The one thing about public health is we are spoiled for choices. There's so many, students usually say, there's so many courses, I got no idea what to take. And I'll show it to you. Next clip, please. So these are our core competencies. Our core competencies are mapped to our core courses, okay? Core courses are compulsory courses, and they are in Foundations of Public Health research methods, where you learn epidemiology and biostatistics, health behavior and communication, implementing public health programs and policies, and ethics. And then there's a practicum, which is kind of a research program that you have to do. And next clip, please. And I'm going to show you the elective. Elective basically means that you can pick and choose from the whole basket, and it looks like this. Okay, there's I can't go through the entire list, so you can take a picture if you want to. I will pause for a few seconds to let you have a look at the various courses that we have. And they are color-coded, so each color code belongs to a particular domain. Okay. Okay, I'm happy to share this as well for those who are interested, because just now during the conversation, some of you have asked me what kind of courses can I take. So there are many of them. Okay, next clip, please. Next slide. And to help you to decide on which courses, because there are so many courses, so we group them into what we call specializations. Specializations are a little bit more like concentrations. So each specialization is a curated list of certain courses which focuses on certain topics. So we have specialization in epidemiology and quantitative methods, global health, health policy and systems, health promotion, occupational health, population health, and in modeling, which are new specializations. So each of these specializations will have its curated list of courses that will help you to decide which area you want to take. Now, but you do not have to specialize. You can choose what you call general, right? In general, you can pick and choose any from our whole basket of choices of courses, things that you feel relevant to your career, and things that is interested to you. Okay. And next slide, please. Thank you. Where do our graduates work? Literally everywhere. So for, I think, I'm online international candidates, potential students, you may be interested to know that some of these are actually international agencies. I can't put everything up there, just selected few of where our graduates work in. So next slide, please. And this is a quote from Dr. Margaret Chan, who is the Emeritus Director General from WHO. So she is actually our alumni in 1985, I think, yes. And that's the quote from there, which you can read. And she's been a strong supporter of the school as well. Next slide. Okay, you ask, do I qualify or not? Okay, so there are two groups. One are the medical trained. So if you're medically trained, you will be MBBS equivalent. You need to have at least 1 year of clinical experience, which means it's your internship or housemanship. And then 1 year of extra working experience in the area of public health. Okay? And that should be easy for most of the clinically trained. Next slide, please. And if you are non-medical trained, which actually majority of students are non-medical trained, and you need to have a good honors degree. That is not a strict cutoff, but that is desired. And at least 2 years working experience in relevant field. We define this very loosely. If you have in the area of health or population health or social sector as well, we're involved in health, those are also related. If an area of research in terms of public health or health related, those are also will be considered. Okay? And for international students, you will need a TOEFL or IELTS. Okay, next, please. Okay, so the next question is, how much does it cost? And next slide as well. Next, okay, the unsubsidized is, we are actually quite expensive program, but good to let you know, our program is considered in Singapore as one of the 2 strategic programs, right? Which means that the government actually subsidizes it. So the next click, and the subsidized rate is quite significant. Next click, please. And the next click, please. So you're looking at about 23, that literally Ministry of Education subsidized the big chunk of it. Okay, and that's the full-time, and part-time is basically just half it because we extended it into 2 years. Okay, and we also have financial aid. Okay, and those are scholarships. Some of the scholarships are specially applied to international students. For example, T.L. Wang's foundation is for international students, and then we have other scholarships. We have also bursaries for needy students as well. Okay, next slide, please. Okay, so I want to give a quick pitch on the graduate diploma. So there are some students who would question and say, I'm not so certain about public health. I want to explore it. And there is an option of a graduate diploma. So a graduate diploma, if you can see from the slide there, is half of our Masters of Public Health. There's no full-time, only part-time. So 18 months part-time. You can't read from the entire course list, but we have curated key courses which we feel that for a graduate diploma, we pitch a graduate diploma as somebody who's actually managing programs on the ground. Right? So these programs will help you to be able to run programs, whether in the aging space or you're in the social space. Okay? And the tuition fees is also there. So a number of our students who are unsure, they can come into a graduate diploma first, and then when they are a bit more certain, then they can do the switch. They can actually switch. A number of them actually switch after 1 semester. Then the courses they read in the graduate diploma can be entirely recognized in the Master of Public Health. So it's just a direct jump over to the Master of Public Health. Okay, and I think that's all I have for us, and I'm happy to take any questions.
Thank you very much, Associate Professor Liow. May I invite you to take your seat, please? Well, ladies and gentlemen, it's time now for a Q&A, and this will go on for 20 minutes. The Q&A session will be conducted via poll EV. For both on-site and virtual participants, please kindly scan the QR code, which will be on screen very shortly, to submit your questions. Okay, you can scan that QR code to submit your questions. For on-site participants, you're in for a treat. You can ask your questions live. The microphones are in the center of the aisle. You can use the microphones then and ask Associate Professor Liow the questions that you have. Okay, so you can scan the QR code right now. So we just give it a moment. I'm just waiting for those questions to come in. Sure. You want to move to the mic? Maybe the one at the back. Thank you.
Hi, Prof. Liow. Thank you so much for the introduction. And I want to ask, right, for just like you mentioned the switch from the graduate, the diploma to master's, that one, how do you do it? Is it you just apply and you get, or you do have to take an exam or something? Thank you.
Yes. So in the graduate diploma, in the first semester, you will sit in the same core course together with the Masters of Public Health students. So the first course that you will take is something called the Public Health Research Methods, which combines epidemiology and biostatistics. So the key thing is that you need to do relatively okay for that. Okay, I wouldn't say super well. Okay, you did relatively well, and that because that is probably one of the hardest course. If you can clear the course, basically clear everything else. So you do well for that, you just come to us. Our administrators will then help you, and then you can actually make the switch.
Thank you. I've got one question on the tablet here. How important is an applicant's academic background in public health or related fields in the selection process? Does professional experience in public health or healthcare significantly influence the selection of candidates? And if so, what kind of experience is considered most?
Okay. Thanks for the question. So, as I said, we define that pretty loosely. Now, but having some form of experience in the area of public health will be helpful. And this is not just a criteria, it's actually helpful for you as a student. Because if you're coming for group work, right, having that background, slight background, actually helps you to learn more and better. Now, having said that, we do define it loosely. So, for example, if you're in the, we got many research assistants, for example, right, or research staff who are involved in healthcare, okay, or clinical care, that would be considered relevant. If you're any allied health, where you're involved in healthcare, that would be considered relevant. If you are part of the social service sector, right, and you are involved in programs, let's say you're running a program or involved in program with aging or for the elderly, for example, right, that in community health, population health, that would also be considered. So the definition is quite broad, and the reason for that is there's a reason behind that, because public health is actually very interdisciplinary. By now you probably can realize that we cross multiple disciplines, which means that the solutions that we need to solve public health problems, right, have to come from multiple domains and disciplines. So I hope that will answer the question online, but if not, you can post the question on Poll Everywhere again.
Okay, one question here. Are there any opportunities for internships?
Not really, because of the short time period that we have, we don't have opportunities for that. However, we do have a practicum project. The practicum project is actually a capstone project of which you do a research project with something, right? And most students who are part-time students, when you're working, what I usually encourage them is to use one of the issues in your workplace that you want to resolve, right? Use it as a research project. If you have data, bring it in, and then that'll be helpful for you, because while you're clearing your practicum, you're also solving a problem in your workplace. Now, for those of full-time students, where a number of them are maybe not at work, you can also look, because students who actually source out various sources to be able to find projects. So back to that question directly, sorry, I'm going in a roundabout way, but the question in terms of internship, we don't quite have that at the moment. Yeah.
Thank you. Another question, I think this is definitely online. I'm Indonesian, not NUS alumni. Is it better if I start from GC first, then apply to MPH?
So the minimum required here is that you need to have a bachelor's degree, right? So if you have a bachelor's degree overseas, that is fine. That is also recognized. So I think the key thing is that you have a bachelor's degree, relatively okay, you do relatively well, and then you have relevant work experience. So you don't have to have a degree in Singapore.
Okay. Okay, are there opportunities that are available for prospective students to connect with alumni? I would love to connect with them for insights.
Yes, write into us. We got extensive alumni. I'm not sure if you write to Dr. Margaret Chan whether she is she will reply. But yes, we have a large group of alumni from various places. So you can write into us. We'll try to connect you to relevant ones if possible.
Okay. How does the MPH's focus differ from Yong Lu Lin's Master of Science in Behavioral and Implementation Sciences in Health?
Okay, I've been asked this question a number of times just now, and I think we can see both as a little bit different. So I cannot speak a lot for the BZ group, right? For them, that focus a lot on the behavioral science component. I can speak more for the Master of Public Health. So Master of Public Health, we are training you to be practitioners, right, and leaders in the field of public health. So the way to look at public health, another angle to look at it is this way. So along a spectrum, right? One end of the spectrum, we talk about clinical health, right? Clinical practice, which is looking at a patient, and I'm treating one patient in front of me. That's how most of us doctors are being trained. Patient come in, I will treat this one patient. Now, on the other spectrum of it, right, on public health side, we got a different angle to it. We're not looking at an individual, we're looking at the population. So it's a large population size, and we're not focused on the treatment aspect, although sometimes we do, but it's more on the prevention of disease or prevention of ill health. So if you look at that kind of a paradigm, anything to do with a population size, preventing ill health, promoting health, right? That is our focus. And we do it through various means I think from my previous slide on I have showed that. So that's a bit different. I think more questions on busy will be better answered by busy. Yeah.
Ken, what are the career prospects of this program?
So many of our students are really in the relevant working industry. And we have a number also looking at pivoting. So as I showed just now from where our graduates are, so a lot of them will be working in, for example, Ministry of Health. They work in hospital clusters, because now with Healthier SG and the latest Age Well SG, so many institution organizations, whether in hospital or social service agencies, are now pivoting towards that. So then a public health, a degree in public health will help you with that, because understanding how policies they translate to programs and how to run programs effectively, that's what we do. We'll train you on that. And there are also opportunities for international NGOs, for those overseas, those of you who are listeners from overseas. So we got students or graduates who are actually involved in overseas NGOs as well, international NGOs.
Thank you. What attributes do you look for in potential candidates?
Okay, so I think just there's not much thing. Though the requirements are there. The requirements are quite sort of as on paper, right? But I would say, have anybody with a curiosity to want to learn and actually to grow better, right? You want to know more and how to actually do better to improve the health of the population. Just look at it this way: Singapore is aging fast, and we know the challenges that's ahead of us, and it's only going to the issues the challenges we face is going to increase, and the way to resolve it, right, cannot be from just on aspect of health alone, because health is influenced by many factors, and that's where public health comes in. We look at things at the macro view and also holistically, and which is why I feel that it's one of the programs that will equip you to be able to take up that challenge. Yeah.
Thank you. What is the attrition rate of the MPH program?
The sensitive question. Okay. Happy to say, very low. The last count, I would believe, will be less than 1%. Usually students who then drop off is mainly because of other challenges in family or their own other issues. Yeah, so not many, because we do screen through our students as well, and I think you should be okay.
That's great to hear. Really good to know. Is the master's program relevant for clinical trials and the regulatory landscape for clinical trials?
Okay, I think I know who asked this question, because I was speaking to someone there. Yes. Now, clinical trials, if you're just focusing on clinical trials itself, we do have courses that's focused on clinical trials. So that's what you can do as well as an option, right? That to read one course, and then that you'll be equipped with clinical trials. But if you want to broaden your scope, right, beyond just clinical trials and look at different research methods, and especially at the population level, and also understanding other factors that affects health, social determinants, and other things, right, at the policy level and programmatic level, then the Master of Public Health will be very relevant for you.
Okay, one more here. How does the school assist students on linking them up with potential supervisors/mentors and projects?
Okay, so what happens if you sign up for the program and you're accepted? Okay, so once you're accepted, our program starts in August. Right at the start, there will be a list of projects that's been put up by both our professors and also by agencies out there. So we have other agencies and organizations who also put up projects for the practicum, the capstone practicum. Then what happens is that the students who are interested in those things will get matched. Okay? You will get a matching in terms of your background, your interests. We try to match the practicum project as closely as possible to your area of interest or your professional background. Then those projects, the professors who are running those projects will then become your supervisors. Yeah, usually that's how it works. So we try to ensure that there is a clear link between your interests and your career and the practicum project, and then the supervisors will then follow through from that.
Thank you. Then next question is definitely someone from online. Hello, teacher. I'm a student in mainland China. Thank you for your sharing. After listening to your sharing, I'd like to ask you, as an international student, what is the approximate cost of tuition plus living expenses for my program at MPH in Singapore?
Okay, I think we can go back. Is it possible to go back to the slide and to show them? Because the cost was there. I think it's about 27, if my memory serves me right. I'm so sorry. If you can flash that up. Can you? Or you? I think it's okay. They can't get that slide up. I believe for international students, you can go back to the slide later on to have a look. Maybe if it's recorded, you can actually look at that. Yes. But I believe it's about 27,000 Singapore dollars or so. Yeah.
I think it was 93 at the top and after subsidies.
No, yeah. 34. So they're all subsidized. International students as well. You go on that rate. You don't go on the full rate.
Okay. Okay. Yeah. Hang on. I think it's coming up. Is it coming up? Or maybe for that.
Yeah, there we go. Yes, 27,950. So international students, you also look at the subsidized rate.
Thank you. Thanks, guys.
Yep.
Next question. Do I need experience in a healthcare-related field for the graduate diploma as well? I have a background in psychology, but currently do not have experience in a health-related field.
Okay. If you're in the background of psychology, I'm sorry, we can't dialogue here because it's a question that's been posted. But if I would suspect if your current work is on psychology, you may be somewhat already relevant, depending on the nature of work that you do. If you're doing in counseling, the area of counseling, in the area of mental health, loosely speaking, right, mental health is also part of what we do as well. So maybe if you want, I'm happy to dialogue with that whoever posted the question more. You can email or by other means, right, and we can explore a bit more.
Great, do take note. Next question here, what is the cohort size each year?
It's about 80 plus, both international students and local students.
Okay. One more question here. Do we need to submit the IELTS score when we apply the master programs or submit it before the DDL? DDL, I think, stands for...
Yeah, you submit it during application.
During application,
yes.
Okay.
That's right.
Hope that answers the question. Are there lab rotations for students to explore multiple fields and lab cultures before committing to one project?
Sorry, can you repeat the question?
Okay.
Lab, is it?
Are there lab
okay.
rotations for students to explore multiple fields and lab cultures before committing to one project?
Okay, so we are not lab-based. As you can see that what we do is, in terms of public health, we are community population health-based. So not so much of lab experience that you have. But if you are interested to explore various areas, my suggestion is that you can probably try to link up with various professors when you're in the school, and you can explore that way. Because the range of courses that we cover is quite broad, so there are many areas and specialization that you can actually explore. So maybe if you're a part-time student, you have 2 years, so the first year you got a little bit more time for you to try to explore and experiment to figure out which area that you may want to specialize in. But even without specialization, right, having a broad, I usually tell students, having a broad general Master of Public Health is actually very helpful because that gives you the broadest possible skill set. And many of we need to think of learning as a lifelong learning now, right? Nowadays, you don't acquire all the skills in 1 or 2 years. So after, when you graduate and you become part of alumni, you are also welcome to come back and then we can read more courses. We got continual education and training courses, workshops, etc. So you're welcome to come back and read more.
Okay, next question. How does the selection process aim to promote diversity and inclusion among candidates, particularly for international students?
We actually, for international students, you don't have to worry. We are actually trying very hard to get more international students. We want more international students, especially from the region. And there's a reason for this. If you think about public health, maybe just think about COVID. or potential other infectious disease or pandemics that come along the way. So we are seeing that our graduates and alumni now are scattered across, and over time, right, after you graduate, most of you will get promoted. You move up to the area of being a director, etc. So imagine a regional space where if there's a health issue or pandemic happening in some certain places, right, that all you have is a phone call away because you are linked by your peers. A phone call away from Singapore, I can call another country's Ministry of Health because I know them, because you're all peers, right? And then the communication and the networking is already there. So that's the goal, right? We're trying to create this kind of network amongst public health practitioners and professionals. So, which is why, if you're international students, we are hoping that there are more actually. In fact, we don't have enough international students. So, do try to apply if you're international students, and we want to see this rich network of public health practitioners around the world. Yeah.
I like the picture you painted. You had mentioned the students will be matched to the practicum in August at the start of the semester. Does this mean we should have in mind a research topic interest before entering? And what if I have limited experience in research?
Yeah. Okay, good question. If you have one in mind, ideal. That would be the best. Now, if you have got no idea, nothing in mind, it's perfectly okay because we will still match you. You will be matched to a certain, you can just indicate your interest, area of interest, or if you have no interest, it doesn't matter. We will still give you professors, and professors will then give you their data. So they will have their own projects, of which then you will work with them, and then you will work out for the project, for the practicum. So not to worry if you have no idea.
Okay. How much depth math knowledge do I need for biostatistics track in MPH?
Okay. That's a tough question. But we have a numeracy test for admission. The numeracy test basically try to make sure that you can handle numbers. That's all we are looking for. So it will be pitched at, say, junior college mathematics level. Okay. The idea is to show that, okay, you've got numbers, you can handle numbers. That's all. The rest of it, we will teach you. And if you're concerned, there are also free courses that you can read, actually online, free ones, right, from Coursera, etc. So then that will also prepare you for that. But not to worry, as long as you can handle numbers, you should be fine.
Okay, that's great. Here, what is the difference between the public health research track and coursework track?
Okay, so the research track, which is our PhD and Masters of Science, focuses mainly on research. So you come in and then you'll be deep diving on research topics. The Masters of Public Health are looking, although we do cover research as well, research techniques and tools and methods, but the key goal of that is to train practitioners. So if you're going to be, if your career is going to be a practitioner, right, Masters of Public Health will be for you. If you are very certain that you are going into deep dive research, right, then you may want to consider our research side, which is the PhD and the MSc. However, having said that, the Masters of Public Health also cover research methodologies, so that can also help you if that's of interest to you.
Okay, one more question here. Can I choose to do the practicum back at my workplace if I'm currently working in the healthcare industry?
In your workplace, I would say use the project in your workplace, and you will be linked to a supervisor, right? And your supervisor can work with your supervisor, your boss, right? And you will become actually the main person driving it, because we want you to learn how to actually do that. And so our supervisor will work you through it. So we do encourage you to use projects from your workplace, because that will be extremely relevant to you, right? And you know the project inside out as well.
Is it advantageous to apply earlier, or can you submit your application before the deadline?
As soon as you can, I would say. So deadline, 15th of November, right? Do it before then. Don't, if you are certain, don't wait too late. Right?
Okay, I hope this answers this person's question. I think we've got time for just maybe one or two more. Anybody from the floor? Anyone else want to submit it online as well? We just give it another minute, okay? Oh yes, one more in. How well will non-medically qualified students be able to cope in this program? Any past examples or cases?
In fact, 2/3 of our students are non-medical. Oh, wow. So I think that speaks for it. Yeah. Public health is not focused only on medically or clinical trained. In fact, I would say public health is much bigger than that. In fact, the solutions, I'm a doctor myself. I would say sometimes non-clinicians do better in public health than clinicians, just because of the way of thinking, we are trained differently. So if a non-medical trained, non-clinical, you will do well, not to worry.
Wow, this is a very good encouragement. One more. How competitive is it to enter MPH? How competitive is it to enter MPH?
Competitive, I would say fairly competitive. So the criteria was put up there already. I would say if you are just try, and we will sieve through it and we will screen through it. So not to worry, as long as you have the key thing is the relevant work experience that's loosely defined. You're having that and clear direction of where public health will then contribute to your career path. I think you are more or less set for it.
Okay. One more question here. I work for a public health organization, but with an administrative role. Am I considered eligible for the program?
Yes, you can be. We probably have to check a little bit more, but we do have administrators in public health agencies coming in to try to broaden, because quite a few actually of them actually in our public health, in our MPH. Yeah.
Okay, good. How are the lessons taught, lecture style, online or face-to-face?
Mainly face-to-face after COVID. And there's a reason behind that. I know my time is running out. There's a reason behind that because public health being very collaborative and teamwork, a lot of what we do is actually in teams, in group work. Now, while we can still work in teams online, but nothing beats that physical part, which is a unique part of a master's program compared to undergraduates. You don't get that from undergraduates. So most part is face-to-face. We do have some courses that are actually online, because our lecturers are actually international, so they can fly over, and so there are unique courses like that. But most part, face-to-face.
Great. Thank you very much, Professor Liow.
Thank you.
That's the end of the Q&A. Thank you.
Thank you very much.